Good morning. We'll call the meeting to order for the day. First item is approval of today's agenda.
Move approval.
Second.
Motion and a second. All in favor signify by saying aye.
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 Opposed, same sign. Motion carries. Citizens to be heard. Any citizens that would like to be heard on any item that is not on today's agenda? Seeing none, employee recognition. Oh, okay. Do we have it over there?
No.
Harry. Good morning.
Good morning.
This is presented to Terry Howard in grateful recognition of 30 years of outstanding and dedicated service to Clay County and its citizens.
Thank you.
So you started when you were 5?
Yeah.
Okay.
Very nice.
Approval of minutes of the November 17th and 2015 meetings.
Move to approve.
Second.
We have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Approve payment of bills and vouchers.
Move approval.
Second.
Motion and second to approve payment of bills and vouchers. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Okay, approval of MetroCog Articles of Association and Fiscal Agreement. Bill Christian. Come on up, Bill. Good morning.
Good morning, Commissioners.
Good morning.
Actually, there is no presentation to this. I'm here to answer any questions that you have on the articles and the related fiscal agreement. I brought this to you several months ago. We were hung up on getting an additional vote for the city of West Fargo, and that is basically the only change from what was presented to you several months ago. We changed the language to make it a general reference in the articles. The actual composition of the policy board will be determined by the bylaws of the policy board.
Okay. Questions?
We've gone through this executive board with MetroCog and on the regular board too, and we've approved the addition of the West Fargo guys, so I make a motion to approve the articles.
I'll second the motion.
We have a motion and a second. Any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Well, that didn't take you long. Thanks, Bill.
That can go to the sundown.
Yeah.
Thank you very much.
Thank
Yeah,
you.
thank you. Request to waive late penalty for late payment of tax. Betty and Jack Demain. Come on up.
Good morning.
Good morning.
Good morning.
I guess to explain the situation, if you're ready. We acknowledged we were a month late as far as the payment was concerned. And of course, that was my fault. And we're not asking for maybe a complete waiver here, but if there'd be some kind of a compromise. I had a lot of medical problems the month of October. I'll give you a rundown on some of the things here that took place. And I know the state sets the penalty and so forth, but the county commission has the right to amend, and I was wondering if there was possibility of a compromise here. Pardon?
I interrupted you, go ahead.
Yeah. And that is basically what I'm looking for. We acknowledge the lateness, but I feel $250 is a little excessive.
The reason was because of medical issues that you were...
Yes. I had written the check, misplaced the envelope, and mailed it later. And unfortunately, my wife didn't find it while
He was,
I was...
he was going through chemo treatments, and we had a lot of things that happened after the chemo, that he was in and out of the lab and to the clinic and things like that. So, and that's why I kind of ran off copies to show you many dates just for the months of October, November.
Wayne.
Mr. Chair, I believe this is a very legitimate request. The domains have never been late on their taxes, correct? And I move to waive the entire penalty.
Second.
We have a motion and a second to waive the penalty. Any further discussion?
I do want to just make it note, since we did get these copies and the public did not, that for every day in October before and mostly after this late, there were appointments, so it is legitimate. There were medical issues.
Any further discussion?
Mr. Chairman, this also does coincide with our previous history in terms of dealing with people that have had medical problems, and in some cases, a portion of the penalty or maybe the full penalty is appropriate, even under some medical situations, but this one certainly warrants a complete waiver.
Okay, all in favor of the motion, say...
Chair.
No, Wayne, go ahead.
And that, does that also include interest?
Yeah, they made the payment, it's just the interest that's remaining. The interest doesn't start accruing until next year, so it's just pending.
Okay.
We're waiving the penalty. Okay, all in favor of the motion, signify by saying aye.
Aye.
Opposed, same sign, motion carries. The penalty is waived, thank you.
Thank you very much. Thank you for the understanding.
No problem. Okay, update regarding Clay County roads. Okay,
Morning.
Jane, come on up.
I think David Overbo was going to be here too this morning, but he isn't here yet, so.
It's a
He's
busy
late.
morning.
That's-
Yeah.
Dave is late, that's shocking.
I bet you're right, the roads are kind of bad this morning.
Dave runs on Dave's side.
Did you want to wait till Dave gets here? That's
It's-
fine, we can wait a little bit if you want.
If you want, if you
Sure,
would
we'll wait
like,
a
that
little
would be
bit,
great.
that's fine.
Okay, thanks.
We're certainly used to that.
All
so
right,
we're-
thank you.
Not a problem, so. We can do our committee reports, so. Wayne, go ahead.
Thank you, Mr. Chair. On Tuesday, November 24th, for Children's Mental Health Early Childhood Initiative meeting, we went over and reviewed all the activities that took place in 2015. Some of these were, and there were more, Mind in the Making, Book Read, Home Visiting Providers, and Children's Consultation Network, something called Happy Smiles regarding dental care at the Warren Center Mall, Kid Fest, meeting with legislators, safety training for home visitors, early childhood providers, networking breakfast. And then there was planning for 2016 and agency reports. And that's the only meeting I had.
Thank you. Frank?
The only thing I attended was drug court on Wednesday, and I really want to compliment Michelle, well, Judge Lawson. And she really runs a good court, and it was nice to see the way she runs it. She posts the penalties, whatever, and I think she gets the respect of the kids there. And I think that she's doing a very good job there. And it was just good to be there and see what's happening there.
That's it. Thank you. Okay.
Last week I had the joint meeting with the Diversion Land Management, as well as the Finance Committee. We talked about 6 properties going forward. All of them, except for one, are in North Dakota. The property in southern Clay County was approved. I was not at that portion of it, so Brian may expand on that if he needs to, but that is all we covered in that meeting. So that concludes my report.
Thank you. Kevin?
Last week I had, last Wednesday, I had a Prairie Lakes meeting, and we talked somewhat about, a little bit about the budget. There's ongoing issues with the facility that they're getting ready to do a stack test, which is done once a year, that really determines how much steam is produced, which then gives a maximum amount that we're allowed to generate in steam based on the MPCA. So we're hoping that that number is up compared to where it had been as a result of faulty equipment that had been installed originally. Then we talked a little bit more about the waste designation plan that we've talked about here, and each county is also doing it. There were some personnel policy issues that we made some changes to. And then they have a problem with the loads that are coming from Clay County. We're the one county that does not, as much as other counties, have the ability to sort the material that's not supposed to go to the landfill. And that's because all of our material that goes to Prairie Lakes goes from our transfer station here in Moorhead. And as you all know, all the solid waste that goes there is all dumped into a container and then compacted and pushed onto a truck. And so therefore, there are some materials in there that are being shipped that they would like to have pre-sorted. And I've told them that that will not happen until we have our new transfer station up and running, which is going to be some time away. And they were concerned about then having to turn around and send that material back to Clay County's landfill and then pay our landfill fee for it. So we've got to work out a deal with them to make that more equal for everybody. Because we are sending material to them, we're dropping it off there, they can't do it, so they send it back to us and we charge them. So there's, but the other counties are also sending stuff to Clay County that they're being charged for too. So that's going to be a work in progress. I want to know that there is a little differences of opinion on that with Clay County and Prairie Lakes. And then yesterday we had a very good jail committee meeting, and things are really moving forward. We got another good report from our architects, and the primary focus yesterday was going through all the different types of construction managers that we can or should consider for this job. And it was the request and by the architects that, based on the timeline that we have with the spring construction starting in 2017, that we need to get these people on board. So our committee has come up with a recommendation as to what type of construction manager we should look for. And our administrator, Brian Berg, will be here next week at next Tuesday's meeting to give that presentation to the full board for consideration and hopefully allow us to move forward with the hiring of that manager. So,
Yeah, we'll be looking for proposals and from companies.
yes, yeah, well, the process will be to look for proposals, yeah. So, and I'm assuming, Brian, that you'll give a brief discussion of what each type is and why we're recommending the one that we did.
Yes, so, Mr. Chair and Commissioner Campbell, I'll try to give an update of the different scenarios, although we've studied this now 3, 4, 5 times, and it's kind of in depth. So, yeah, and then ask for the board's approval to seek qualifications from different firms.
That concludes
And that would be next Thursday evening?
Oh,
because
that's
Tuesday we do
Thursday,
not
right.
have a
That's
meeting.
That's right.
Thursday meeting, so.
That's all I have.
Thank you.
In line, doesn't she?
I had the same meetings Kevin did with Prairie Lakes and the jail committee, and he covered those quite well. So, Brian, what do you have for us?
Well, Mr. Chair, I attended the diversion land management meeting, and I think Mr. Mojo covered it quite well. There was 6 or 7 land purchases on there. One was in Clay County, which was very, very important to us. It was important to this board. This board had taken action requesting the DNR to consider waiving some requirements because this was a hardship case, and they stood neutral on that, and we did a lot of research with the attorneys to see if it would affect the case, and back and forth, and then there was some comparable properties that were at question, and so this has been quite a process for these people, and I'm just very happy to report that the Finance Committee and the Land Management Committee approved this, and it's already in the hands of the southeastern, land manager or soil conservation, what's it called over there?
Southeast Castle Water Resource.
There you go, for a purchase agreement with these folks. So it's moving on down the road, and it took a long time, but it's there. So The folks were really, really happy. They were in again last Wednesday afternoon to talk to me about this. And I told them that, the commissioners, I know Commissioner Mojo and Commissioner Campbell was the one that received the call on this, that brought it to our attention, that got this thing moving, and it was several months ago. Really appreciate you following up on that and staying with it. That meant a lot to these people. I attended drug court with Commissioner Gross and thought it went well, really did. It's a good program, and when you realize that's one less person each and every week, well, there's more than that certainly, that are staying out of jail, and I'm going to give you a report in a few minutes on jail costs. It's really important if we can see some improvement on these individuals without having them to sit in jail at the cost of the county. So that's a real good thing. Had new hire orientation yesterday. There was only a couple there, but hopefully the hiring process is going to slow down fairly soon. We've hired a lot of people this last year. Rhonda and I met in regards to social service budget and position that she's going to be talking to you about today, so I won't go into detail on that. The jail design committee, I think Commissioner Campbell and Wayland covered that quite well. It was a very good meeting. I think we're really making progress on the design, and we'll ask the architects to come and make a full presentation to the board fairly soon when they get the design, maybe in January, February, somewhere in that, to report on the progress that is being made. Houses are going really well. We'll have closed 12 by the year end, and that's shaping up, and we'll need to get seriously discussing a law enforcement center with the city council as well. So that's going to be coming down the road too. So to see where you folks want to go with that. The jail budget. I know Julie was in regards to the costs of the medical care that she has experienced. And I think it was Commissioner Campbell that asked her to do an upgrade or update on her budget request for 2016. And I will pass out what she gave me just last week here. I'm glad you're sitting down.
Yeah, I was going to say this is going to be painful.
Yeah.
Are you kidding me?
I'm sure the prisoner board, the way it's been, I mean, we have to be
Additional?
We have to be double at what we're.
This is additional?
This is additional.
This is an
I'm sure
additional
we're double what
request.
we had budgeted based on what's been going on, so.
Right, and she's broken it down into three categories. The medical budget increase of $82,000, a prisoner board and she's showing her calculation there, and she's basing it on 50 inmates. I am hopeful, but I guess I don't work in that business, so we have to rely on what they're telling us. Her original request in her budget was quite an increase, and she was basing it on 39 prisoners out of county a day. And now this new one, she is basing it on a 5-month average in the last 5 months, and an average of 50 inmates out of county. So I guess I wish I could say that was a spike, and that's not going to stay there.
Well, this just brings home the need for a new jail. I mean,
It really does.
It's tough
Yeah.
to argue that point at this stage, so.
And then you'll see a slight increase in the food budget with the about $5,000, $5,700. So a grand total of $442,000 more. Now, Lori and I have discussed this. I don't see Lori here right now, but we feel from an auditor standpoint, we need to put that in the budget. We're going to suggest to you that we rely on reserves to cover that cost. And then we will have to see if those are, if the counts stay up that high, we're going to spend that. And hopefully the counts will come down to more of a normal line rather than a spike. I think we're seeing a spike right now. Let's hope this this little prisoner count goes down, but they've got to, they don't have a lot of choice when prisoners are brought to the door, and the county doesn't have a lot of choice. So it's really puts us between a rock and a hard spot. So with that, Mr. Chair, that concludes my
Thank you
report.
for the good news, so.
Yeah, sorry.
Okay,
I have one-
Jenny.
Excuse me, one quick question. At what point are we running out of places to ship these prisoners?
Frankly, Mr. Chair and Commissioner Mojo, that is a good question, because they, I know they're running them to Stearns now. The main one, of course, is Crookston, and then we fill in at Wilkin County, we filled in at Alexandria, and now I think we've gone to as far as Douglas, or Stearns County as well in St. Cloud. So, yeah, I don't know at what point.
Well, that's the risk for us, is that other counties are experiencing the same.
Yes, they
thing,
are.
So,
Yeah.
okay, thank you. Any other questions for Brian? Dave and Jane, come on up.
She says not.
Good morning.
Good morning.
This sort of snowy morning, our first snowy morning of the day. Kind of fitting we're here today, huh, Dave?
Yeah.
Well, thank you guys for having us. We do have a little report here for you, just kind of on the Safe Roads Coalition activities that we've accomplished over the past year. I think I was here, was it a whole year ago already?
I think it
or-
has been that long.
Yeah, it's been a while ago already since I was here, so. We had a really successful first year. We're pretty excited about that. Hopefully you guys saw some of our things that were out and about in the different communities that you serve. This was kind of our most recent thing that was countywide with all of the school districts and the law enforcement that were involved. We had high school athletes that participated in a media thing where we had all the newspapers and television show up. So that was kind of fun. We did have our regular coalition meetings, and I gave a listing. I think you guys got a copy of this, correct? Okay, so I gave you kind of a listing of all of the activities that we have been conducting over the past year. We did, if you were at the community parades, hopefully you saw some of the fire departments that were displaying the safe driving messages that we have across the county. There was a mock crash that was really, really successful in Barnesville. So in the Barnesville community, there was a lot of publicity and awareness surrounding that. And the Ulen School had participated in a seatbelt poster contest. That was for the elementary grades, and that was really well received and fun. I'll give you some pictures of some of the things that we've done there. And then I think I'll let Dave talk about, recently we've worked on getting some feedback from different areas on highway safety. So you want to talk about that, Dave?
Yeah, Jane met with some of the EMS folks around the county, trying to gather information on certain hot spots and things that they're seeing, maybe repetitive crashes or areas of improvement that might be overlooked from a highway department standpoint. Maybe, from our standpoint, things look fine, but yet they're having a lot of crashes there. So some of the things that they targeted areas, I guess, were what I kind of call historical crash areas. There's one down by Barnesville, I think they call it Dead Man's Curve, and that was on three different of the meetings that they had. So there isn't a lot that we could do on some of the areas, but it's nice at least to kind of note that where these areas are at. There's also some city streets and things like that, and there again, other things that we can't fix, but there was several things on county roads, particularly intersections, I guess, that they noted. So we gathered that information. I've ordered some signs. There was the other thing that I noted, and I get this not only from like EMS people, but just regular county residents. Speed control seems to be a real big thing, and everybody wants to put up a sign or a stop sign to try to control speed. And whereas it sounds like a good idea, that's just not the way that works. It's more of an enforcement issue. So I guess maybe working with the sheriff's department a little bit on that and giving them the information. I guess they're in our coalition as well, so they're getting this. As Darren Bredman is the county deputy that's involved in there, and very active in this and has been since I've been with the county for 15 years. So like I said, we're going to implement some additional, the flashing LED stop signs have really taken off. I've got nothing but really good feedback. They're kind of expensive. They're about $1,700 a piece. so they're over $3,000 a pair, but they last a long time. We haven't had any issues with them. It's kind of tough when they get dinged into a little bit because they're so expensive, but I really like them. And I know back in the day, Commissioner Waller had the county put some up on Trunk Highway 9 and Highway 26 where there's a fatal accident there, but we're going to continue to put up a few more of those. The most recent location is on Highway 34 by the Felton Piler. There's just a tremendous amount of traffic up there in the fall, and there's lots of lights from the piler, and we're also going to put up some overhead lighting there too in a couple of years. We got some federal aid money that we're going to do that, so just wanted to share a little bit that, it was good to get the information from the EMS folks because they're the first ones out there and they kind of see things that maybe from a different perspective, so.
I wanted to point out that's really an innovative approach to getting feedback, so we really appreciated that from the Towards Zero Death position. It isn't often that we get the opportunity to go out and go right to the source of the individuals who are in the community seeing this stuff. So the next step to that is that we're going to talk to the bus departments, the rural bus departments, to kind of get their feedback as well, because they are traveling those same rural roads day in and day out and kind of see where the concern areas are that the rest of us necessarily don't see. So I wanted to thank Dave for doing that, for being really proactive on that, and we really appreciate that from the coalition's perspective. So just a couple other tidbits, but we did review, we have what's called a crash review committee that meets throughout the year. We meet every quarter and we look at the different crashes that do occur, try and look at some trends and identify the things that, like we can change. We looked at 9 different crashes that resulted in 3 fatalities, and that was during that time period. So don't use this as an annual quote of information because this doesn't represent a calendar year. It represents the years or the time that we look at them. But during that time, all of the individuals who died in crashes were Clay County residents. So oftentimes people think that it's tourists or others who are traveling through our counties that are the people who are dying on the roads, and that's clearly not the case here in Clay County. So it is your residents, your constituents who are the ones dying out there. Males, unfortunately, all 3 of the individuals who died were males. And we do know that, unfortunately, middle-aged males do have a tendency to be a little bit higher risk takers or maybe not wearing their seatbelts, which is also a big thing. So those are the things that we are seeing here. And then with that, I will just let you read the rest of it. I don't know that there's a whole lot else to point out. I have some stocking stuffers for you. You guys can pass around. You can give them out to your grandkids or your kids or whatever. Help to spread the word.
Kids.
Yeah, kids. There you go. So thank you guys for helping us to spread the word. We are here as a resource for you. If you are interested in any kind of presentations or activities in your own individual communities, please feel free to contact me or Dave or Darren or the sheriff. They know how to find us too, but that's what we're here for. We'd like to get out and do more promotion. So.
I would like to address one now, if I could.
Sure.
With the recent removal of the toll bridge on 15th Avenue North in Moorhead, that intersects with our county road here on 11th Street, which is also a county road, and it moves on and intersects with Highway 75. And that traffic has gotten so significant that I just found out yesterday that it now meets warrants here on 11th Street for signal lights. And I would certainly hope that we pay close attention to that on Highway 75, 15th Avenue. Sure. I know now it's a four-way.
It's a four-way, yeah.
Four-way stop, and even going so far as going all the way east over to 34th Street. The traffic has picked up incredibly in that area. And so when we talk about safe roads and traffic lights in those areas are going to be really important. So.
And I guess that brings up another point, that if any of the rest of you hear from individuals throughout your areas with concerns, I'm assuming that we'd be interested in hearing that feedback as well. So feel free to share that with us at any time as we're gathering kind of this information. So.
Jenny?
I think we all are hearing where areas may be that people are speeding, and I recognize that it's an enforcement piece, and while our sheriff's department is busy with many other things, have we looked at adding those SNAP ticketing devices to our major areas that we're having complaints, to where we can rotate around to other places?
I think you're talking about the enhanced mobilization periods. Is that what you're asking about? Where there's a specific spot that they focus on?
I'm not
or
sure.
area?
No, for instance, when I go to my in-laws' place in South Dakota, there are those flash ticketing devices on the road. So if someone's
gotcha.
speeding, it snaps and I get a ticket 2 weeks later.
I'm not sure if we have that in Minnesota or
I-
not. Do we?
I haven't heard it with Minnesota.
Okay.
My understanding, and don't quote me for sure on this, but I think it's illegal according to Minnesota law.
Okay.
I do believe that South Dakota allows it. I'm not sure about North Dakota,
Okay.
but I do not think that Minnesota has passed that law allowing that.
Okay.
Several
yet.
states do, but
They
Minnesota
do.
does not.
Yeah, that's my understanding.
Something we did talk about is real similar though, is those LED, those radar stop sign things, you know, that if
Yeah.
you're cruising through an area, it'll let you know if it says 40 and you're going 55,
It'll
it'll,
flash.
They flash.
yeah, and it'll.
Those work. They
I
make
think
you
they
slow
do
down.
work. And we talked
do.
about those at our coalition meeting a little bit, as far as some.
They work for me,
Yeah, they work for me
because
too.
I slow down when I see it.
Yeah. So we may be implementing some of those.
Okay. Thank you.
Well, thank you guys again for your support.
you.
We appreciate it.
Thank
Good
you
to
very
see
much. Thanks, Dave.
He's fashionably late.
He did just fine.
Yeah, Dave, we'll have to tell you, yours are always like 15 minutes earlier than me. We'll see you at Highway Tracking right after the meeting? Sure. Okay.
Rhonda, come on. Good morning, Rhonda. Got several items this morning, it looks like.
Yes, I do. All right.
Good morning.
All right, the first item that we have listed there is our annual, well, it's not our annual, but our 2015 accounts receivable write-off. So wanted to just, so we passed the debt write-off policy, let's see, in 2014. We passed that last year. And if you recall the conversations, there was a lot of, 20, 30-year debt that we were cleaning up, and Sandy and her staff have been going through. We did a large cleanup last year, and what we have here today are a few of those back, from 1994 that we wanted to get cleaned up by the end of the year. So I'm going to let Sandy talk about those items and what we're requesting.
Well, we only have 4 cases this year compared to last year, which was many, many more. We have 2 cases in the detox area for a total of $7,677. They do go back quite far. We haven't been successful in being able to collect. We've tried the tax offset, been on the books for many years. So we're requesting to write off those 2 cases. And then we have 2 cases in the area of foster care for a total of $15,859. We were successful in collecting $5,703 on one of those cases. But we have not been successful in collecting through revenue recapture for the past 3 years. So we have those 2 amounts that we would like to have board approval to write off again.
Jenny?
I'll make a motion to approve the write-off for the accounts receivable.
I'll second it with a comment, please.
Go ahead, Kevin.
Again, when we first started cleaning this stuff up, I think we started in 2013 when we started that, and it did raise a large question to the public. And what the public needs to remember on this is that this isn't a surprise to us. These are numbers that technically we budget for, that we never expect to collect, but we still try. And so therefore, they stay on the books so that we can try to collect them. And once all avenues we've gone through all the appropriate channels to try to collect, then we write them off. But it does not reflect any different in our budget. We've budgeted for it to cover it.
Correct. And I would just also add in the foster care area, that number is a little inflated because on one of the cases, I think we didn't get communication back from the parent.
Right.
And so we ended up billing them the full cost of the out-of-home care, so that number, and we knew we wouldn't be able to collect that anyway, but we didn't receive income information. So it's, you know, it shows there as a larger number when in fact it really in reality would not be that high, but that's correct.
I think another way to say it is it's the services that we did were required of us to do, but you know, unfortunately, in some cases, we can get reimbursement for those, and in these cases, we can't, but the work still needed to be done.
Correct.
Okay, we got a motion and a second. Any further discussion? Hearing none, all in favor signify by saying aye. Aye. Opposed, same sign. Motion carries. Okay, sexual abuse treatment program.
Thank you. I'll have Brad come up for that.
Good, how are you?
Morning.
Good morning, Brad Burst from the Department of Corrections.
Okay, the next agenda item, I asked Brad Burst to join me because most of the referrals for this program come through the Department of Corrections. Well, all of the referrals come through the Department of Corrections. And in the board packet, I had provided to you a little bit of data about this program. This is a service that's provided in Fargo, North Dakota, but it's a collaborative service that involves Rape and Abuse Crisis Center, the Village Family Service Center, Southeast Human Service Center, Cass County, Clay County. It's been going on for over 20 years. We've been involved with this, and it's changed over the years. More recently, though, in looking at this program, our utilization of it has really changed. And in fact, Cass County, I had a conversation with my counterpart in Cass County last week a little bit about some of the history with this program. And in the past, Cass County had contributed additional dollars as well, but then had pulled out some of those dollars. And at that time, Clay County's contribution had continued. Because I was confused as to how come, you know, Clay County's contribution seemed more significant than Cass County's, but yet our numbers were lower. So I was trying to resurrect the history on that. But we had continued some of our funding. I think what we're realizing, it's time to take a look at this. I have talked with Southeast Rape and Abuse and the Village and have indicated that I intended to bring this to the board today and review the appropriateness of our continuing the contract. So I wanted you to hear a little bit from Brad about how he utilizes the program and how the needs are being met in other ways. Okay.
With the Department of Corrections, I'm the sex offender agent for Clay, Wilkin, and Monoman County. And so I handle both probation cases in this county and any parole supervised released case. The Department of Corrections, the Southeast program, the sexual abuse treatment program in Fargo, in the past handled both North Dakota probation parole guys, Minnesota probation parole guys. It's done in a group setting or individual. Well, the Minnesota Department of Corrections also grant funds treatment programs throughout the state. And one of the grant-funded programs that I am using, Upper Mississippi Mental Health, is based out of Bemidji. They cover this region with treatment groups in Crookston, Bemidji, Park Rapids, and Detroit Lakes, which I use. Those treatment groups, there's 3 treatment groups running on Mondays. The reason for the switch is the Department of Corrections grant manager came down with several requirements in the last couple of years of how we are supposed to do sex offender treatment. It is supposed to be done in an agent-therapist model, meaning supervised agents sit in the treatment groups with the offenders and the therapists. That way there's a consistent message. There's no splitting between supervised agents and therapists. In addition, they came with a requirement that sex offenders that complete prison sex offender treatment, which is often 36 months in duration, where they're living on a sex offender pod for 3 years must be given credit for the treatment they've completed in prison. And so what Upper Mississippi has been doing in conjunction with the supervising agents is immediately get them in our outpatient groups. If they pass their sexual history polygraph, we fast track them, put them into aftercare, which we call integration. So for a year, they can work on the skills and their risks while they're in the community. Another requirement is timely completion of treatment. In the past, there was an issue with offenders staying in sex offender treatment forever. That really wasn't best practice. That really wasn't reducing risk, because all research says if we can get these guys to complete sex offender treatment, pass their sexual history polygraphs and maintenance polygraphs every 6 months, that their risk to sexually reoffend is right around 5%, some studies even 3%. So it's very important to get these guys through sex offender treatment and back in the community being productive with low risks. The Southeast program, the sexual abuse treatment program, does not use the agent therapist model. A lot of the Department of Corrections requirements haven't been adopted through various reasons. And again, they have a lot of North Dakota offenders that just don't really fall under the requirements that the Department of Corrections in Minnesota has said this is what has to happen. So all my referrals for the last 2.5 years have went to Upper Mississippi Mental Health, where the offenders are going to Bemidji. Right now, I probably have 15 guys in that group. I probably have another 8 individuals to refer there. I have a caseload of approximately 65, 66 sex offenders in my 3 counties. The majority of them are in Clay County. The majority of them live in Moorhead. So we're not saying that the sexual abuse treatment program isn't a good treatment program. It's just not what the Minnesota Department of Corrections says should happen, and this is how we want treatment to be done if you are to receive grant-funded dollars from the state of Minnesota and from the Department of Corrections, because those grants fund approximately 85% of the cost of treatment. And then the offenders pay their monthly share, which is right around that $125 to $150. And every polygraph that they're required to take is $375. That helps supplement the Upper Mississippi program, but the bulk of their funding comes from the Department of Corrections. So I'm here in a kind of a unique situation to try save the board some money, not ask for money.
We do, on the request, we indicated, so there's been 2 ways that we fund the program. We provide rape and abuse with a little over $1,300, $1,324 for the coordination side of things. And then we've been providing the Village Family Service Center for part-time therapy time, close to $20,000. So the contribution that's been coming from Clay County has been $21,198. So Brad does have 3 individuals that he hopes to be finishing up in this program that have been in there quite a while. So our recommendation was to divide the funding to continue for 4 months through April 30th. So that would give those 3 individuals time to complete their program, and the organization's time to consider how they might continue operating forward.
Okay, questions? Kevin?
So moving forward after that, then because of this change, these services will no longer be used. Is that how I'm reading this?
Correct. The referrals.
So the local portion that's Clay County's responsibility to pay, is that now going to, are we going to be paying this outfit in Bemidji for the amount over and above what Department of Corrections does not pay?
No.
Okay.
our sex offender treatment groups in Minnesota are grant funded. The Department of Corrections gets grant monies from the legislators, and then the Minnesota Department of Corrections divvies up based on how many treatment facilities we have in the state of Minnesota, the regions, and they allocate those grant dollars. So there is no request, no provision that I'm aware of where Upper Mississippi comes to the counties, and there's multiple counties that are served by...
That use their services, yeah.
Right.
Yeah.
So there's been no request from that. Anytime the grant shifts downward with lesser dollars, and it just recently did, well, then the offenders have to pay a little bit more for their portion of the polygraphs and their monthly costs. That's just a requirement of being on supervision.
Jenny?
I'm going to approve this request. However, I just want to make it very clear to the public that may be watching this that our action today is not providing less service to those sex offenders that are in our community. And I appreciate not often do we have the opportunity to kind of reevaluate things, and if it's maybe not the most cost-effective way of serving our citizens, kind of readjust. So with that, I'll approve the motion to terminate the county contribution for the program effective April 30th, 2016.
Motion and a second. Any further discussion?
Just that one question. You said you have 65 cases of sex offenders in the 3 counties?
Yes, and they are all felony level sex offenders.
So really, this would not go down. These cases aren't going to, because once you're rated as a sex offender, you really don't get off the list, do you?
Well, we have lifetime registration, we have 10 years registration, but every offender that is sent to prison for first degree, second degree, third degree, fourth degree criminal sexual conduct, there's a mandatory 10-year conditional release, meaning mandatory 10-year parole. There are individuals on my caseload that have had a prior sex offense and now have another qualifying sex offense. They have lifetime conditional release. I have individuals on my caseload that have lifetime conditional release, lifetime parole, meaning there's no provision for them to be discharged from supervision. So because of what the legislature has done, our prison sentences have increased, our length of supervision has increased, our caseloads are, increasing as well, and it's a push for more services in terms of sex offender treatment. Upper Mississippi has been able to manage that because we went from one group on Mondays that was 4 hours in duration to recently 3 groups. Each group is 2.5 hours long. And we had to do that just because of the sheer volume of referrals and offenders sitting in those groups. We were sitting at 20, 23 individuals in a group, which was really non-manageable. And the Department of Corrections says you have to get those numbers down so that it's a more manageable number so we can move these guys through treatment.
I was just trying to get some grasp on the sex offenders there are. So are there other people than you that have cases too, or you? It's just the whole thing?
There's possible that someone who has a duty to register has now committed a burglary, assault, or something like that, and they're now on supervision for that offense, but they have a duty to register. Typically, I don't handle those type cases because they may be in domestic abuse programming, they could be in drug court, they could be in a more specialized situation. I handle all sex offense related, or the original charges were sex offense based, and due to the circumstances, they have a duty to register. It may be kidnapping. They may have started with a sex offense. It may have been reduced down. I do handle those if there is a significant public safety issue.
Kevin? Just to follow up on Commissioner Mojo's questions to obviously sexual abusers that are put back into the communities it raises the attention of neighborhoods. That we all know that happens. So all of those, for example, that are in Clay County, report to you and they go through the polygraph things and all that type of stuff, and you have your ways of checking on them periodically, I'm assuming. And I'm assuming you also then, because I know at times, I know Commissioner Whalen as being a former police chief, I do know that, you know, we hear talk of it, when, especially when we have the higher degree sexual offenders, that there's more attention paid to them on a regular basis, not only by the Department of Corrections, but also by our local law enforcement. And I'm assuming all that continues to happen.
Right. A new case that comes from either probation-wise or out of the prison, they're seen on an intensive basis, and usually, the majority of the time, I'm seeing them in their homes. I also see them in treatment group, but the majority of my contacts are done in the offenders' homes. So on the average, once a week, I'm in their home. Sometimes I may be seeing them in treatment, but initially before they're in treatment, I'm seeing them 3 to 4 times in their home. There may be an office visit based on other things that need to get accomplished, whether it's paperwork, things like that. But they're seen intensively. The very least, the Department of Corrections sees a sex offender on supervision. And granted, I have individuals that have been on supervision for 10 years, 11 years. There's never been a violation. You know, they've been in compliance. The minimum requirement of supervision would be 1 home visit quarterly. But they have to certainly earn that through the progression of supervision. But everything starts off on an intensive basis. And we also have our intensive supervised release unit that handles all level 3 sex offenders. They must remain on intensive supervised release for the duration of their supervision. So that unit is kind of side by side with me, but they're based out of Detroit Lakes. It's a 6-person team, and they handle the region. And they handle anyone that is a level 3 coming out of prison, or other very high-risk individuals with a pretty high public safety.
Well, thank you for explaining that process. I know it still doesn't relieve residents who have, especially like the 3rd-degree people in their neighborhoods, but at least there's some assurance that there's a lot of things going done to...
Unfortunately, it sounds like you're busy. So.
Right. Well, in addition, the Moorhead Police Department assigns an officer for every one of my guys as well, and they see them quarterly as well. Okay. So there's 2 checks and balances to make sure registration is being compliant, offenders are living where they're supposed to be living, registering their work, their vehicles, their phone number, and any address. So.
Wayne?
You mentioned earlier 1st through 4th degree offenders.
Correct.
Which is worse, 1st or 4th?
First is the most severe.
Can you give us an example of 4th degree?
4th degree could be felony sexual conduct towards someone. It could involve touching. It could involve under the clothes. It could involve even some other more severe things, but because of the nature of the circumstances, it isn't charged higher. 4th degree is still a felony. In addition, child pornography carries conditional release. There's a list of offenses.
Thank you very much.
Right.
Okay, any other discussion? We have a motion. All in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you, Brad. Good.
Thank you, Brad.
Yeah, thank you, Brad.
Okay, request for a halftime
Yeah.
child protection.
Okay, I'm wondering if it would be okay to go to the case aid position
Oh, sure.
first and
Yeah,
then
not
back
a
up?
problem.
Okay. So I did receive a notice of retirement for one of our case aides that's been with our agency over 30 years. She is ready to retire at the early part of 2016. She is a case aide in our Child Protection Service unit in Scott's unit and does a variety of things. She helps our social workers do supervised visits when we have kids in care, which we'll talk about in a little bit about those numbers. She helps provide child transportation. She manages our volunteer driver program for the agency. She completes background checks, child and adult maltreatment checks, and background checks for facilities or child care homes being licensed in our county. She works with our daycare, child care providers who are under a legally non-licensed status. She does all kinds of things, and we need her and we need that position. Unfortunately, she's decided to retire, so we're requesting to fill her position upon her retirement.
Move approval of the request and backfill if needed.
Thank you.
I'll second the motion.
Motion and second, any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign, motion carries.
Okay.
Thank you.
Okay, now the last item, but not least for sure, is child protection services. You know, you continue to hear about the jail and the work of probation, and we are continuing to feel it in our child protection unit. Over the last year, you've been hearing a lot about our child protection services. We've been staffing up we have 2 units in child protection. Our first unit is our assessment investigative unit. You've been hearing most about that unit over the last year and some of the child protection funding. The other unit is Scott's unit, and that is where longer-term cases, most all placements, get transferred from this unit to the longer-term case management service unit. So as you would expect, as this unit caseloads triple, that flows down to Scott's unit. And most often, all those placements, those cases that require intensive case management end up in Scott's unit, and we're struggling there. Previously, you approved a .5 child protection position that we were going to put in Scott's unit. That was in March. We have not been able to fill that position. Originally, we were coupling it with the .5 adult protection. We didn't have any internal interest in that, and we've interviewed twice and have been declined twice for outside candidates. I think what we struggle with is we were trying to mix adult services and children's services, the .5 and the .5. 2 supervisors, different service arenas, and perhaps that wasn't a good mix, but we were trying to fill the need. So what we're requesting today is adding a .5 so we could make the .5 and the .5 one full-time employee in the child protection unit. So the additional cost, and I'm sorry, this did not come out in your packet, but I do have some information. The cost for adding the .5 would be a little over $39,000. And if you go right to the bottom, the cost impact funding source, anticipating, again, kind of where we might have landed with the sexual abuse treatment program, I'm asking that we use some of those funds to support this position. And because of the case aid that's been here over 30 years, that turnover, as well as a chemical dependency turnover that we had this year, those budget savings in 2016, those 3 items would cover the cost of this request. I know there are a lot of places to use this savings. I understand that.
These are one-time savings.
Well, the turnover in the positions, of course, as the years go on,
goes up.
Go up as well. The sexual abuse treatment, the change in that context, of course, that would be an ongoing savings. So those dollars would still be available for future years as well. But,
yeah, I guess my point is that they were still going to be used for something, weren't they?
The sexual abuse treatment funds. Well,
the dollars we were going to still get.
Well,
or are we going to get more dollars as a result of this hire?
Yeah, no, those, for example, the sexual abuse treatment dollars, those are all county dollars. So if we just simply terminated that contract and the savings of the $14,294, of course, could have been a savings to the tax levy. I'm requesting that we divert that into this position to help support the position.
Jenny?
At some point, I think we collectively need to recognize the fact that the jail isn't the only thing increasing in our county. We're not facing $1 million extra to our budget because of the people that are in jail. When those individuals are arrested and charged, their effects do not stop at the jail entrance. There are children that are left because parents make poor decisions and so I think, while this may seem as a shock and it's unfortunate, at some point we need to realize that we cannot just add extra dollars to a jail and expect the other departments to not feel any effects. And I think this is one of the foremost things that happens when individuals are being arrested. And while I don't want to have to spend additional monies on this, this position has gone empty for a while, and there are people that are slipping within the cracks.
I would also add our out-of-home placements are at, I just pulled the report yesterday. So for November, we've had 170 kids in care, and I kind of kept going back year after year and went back, got back 8 years, and we've never had that number for any given month, back 8 years. And I think I went back even to the year we were dealing with the meth issues, trying to see if we had that high of a number, and we didn't even during that time. And I think that's what our staff are struggling with. When you have kids in out-of-home placement, the intense work that requires and should require, the court involvement, the visitations, and all the work that goes along with an out-of-home placement, we're struggling, and staff are struggling to keep up and to make sure that we're tracking those placements as we should and assuring that they're successful.
Wayne? Mr. Chair, as Jenny said, this is just going to increase. It's not going to go down. And article in the paper this morning, I don't know if you saw that, regarding a couple of children who were in some very serious conditions, and I moved to fulfill the request as presented.
I'll second that motion.
Okay, we have a motion and a second. Any further discussion? Jenny?
Maybe to elaborate on what I just said previously, at some point we also need to stop the trend. And if we have countless children that are neglected, one, due to our short staffing, but also due to poor choices by others, it's only going to get worse. And if we neglect at the stem of it, then we can only imagine how bad it's going to get.
I couldn't agree more with the statement that was just made. You know, we try endlessly to end homelessness. We try endlessly to prevent our veterans from being homeless and all of these things. And we should also try as hard as we can to make sure that these situations don't have to keep escalating. There's got to be something that we as a community can do for prevention, as well as just having to take care of the problem after the fact. Or it's just going to grow beyond ability to afford it with the way it's escalating. So I agree entirely with that. I did have one question in terms of the out-of-home placement. I'm just trying to get my handle on who these kids are. Are these kids who have been in trouble with themselves, or are they a result of parent actions that require them to be removed? I don't know. I'm assuming it's maybe a combination of both, but can we just get a handle on what that is?
I certainly think it's a combination of both, but the majority certainly are issues with parents who are dealing with pretty significant mental health, chemical usage, kids really experiencing pretty severe neglect. But certainly there are some of these children that are in care due to significant mental health issues that they themselves are dealing with.
That's the cause rather than the parents in some cases.
In some
but
cases,
most of it is, it's a result of the inability of parents to.
The majority are, yes.
And sometimes we've seen a shift. Sometimes we've seen higher, more older adolescents, more coming out of the probation system. We've been seeing over the last probably 3 years an increase in kids, little kids, babies in our system. And as Scott said, that mental health, the chemical health in the child protection arena, that certainly comes from both.
You know, back, you mentioned, you checked back when meth was the real big issue, and I think that was probably when you were still police chief, Commissioner Whalen, and that was a huge issue.
Right.
And what we did all the way from a federal level to a state level to local level, we did things that had an impact on that. And people don't realize it, but just with some of the things that we did with change in laws and the ability to change people's access to some of the product that causes the problem has made a significant impact in the meth. We no longer see the massive meth labs that you see around because they don't have access anymore because of prevention laws that have been put in place. I don't know if it's going to take something like that for these people, these parents that are doing this to their kids, but something's got to be done.
One of the things, and maybe in January, I'll come before the board and we'll do a presentation about some of the community-wide efforts that are happening around the prevention of child abuse and neglect, prevention of sexual abuse. We have some really good things going on and some new things that are just getting started, and that might be a nice, even community educational opportunity to talk about some of the things that we're doing. So we'll plan for that.
This is a classic example when people get their tax statement and they see their property taxes going up. It's a result of some, like not just what Jenny said, not just because of our jail, not just because of our health insurance costs rising of our employees and our employees' wages, but there are these community issues that we're responsible as a county to make sure kids are safe.
Absolutely.
So I thank you for your work, and but I certainly hope we can keep finding ways to reduce that out-of-home placement. That's nothing worse than that.
Yeah, we are trending to spend at or slightly above what we did when we were dealing with the meth issue.
And
we're at
so
that
that
level.
number is probably, it's reaching 3 million?
Yeah, it's about 2.9 is what we're trending to reach this year in 2015. And we were at about a little over 2.2 over the last couple of years.
Right.
Okay, we have a motion and a second. Any further discussion?
How long do we keep kids on this program? I mean, how old?
In home placement?
Yeah.
It can vary. Sometimes children are placed, for example, at our West Central or in a local foster home. It could be overnight or it could be a few daave. But we have some kids that have been in placement for several years, and we're working
I meant
towards
age group.
permits.
What age group do we?
We've placed babies right out of the hospital.
But how old? I mean, once they're so old, do we?
They can stay in foster care up to 21 if they're still in high school. But we don't have many past the age of 18. I would say a handful of kids past the age of 18, but otherwise.
Okay, motion and a second. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Brian?
Mr. Chair, if I may, before they leave, and I know this isn't anything you don't know, and it's more of a soapbox issue, I probably shouldn't even go there, but I guess I've said it to other groups. The county, unfortunately or fortunately, sits in a position of dealing with symptoms of greater problems, and I think that's what Commissioner Campbell and all of you are talking about here. Here we are in tax times, and every one of the facilities that deals with children and youths and adults, from our detox center to our jail to our juvenile center to our own home placements to our misuse of these families, we just have to keep dealing with the symptoms because we're not in the position to deal with the cures. I wish somebody could explain to us what what the real problem is. I think it's the family fabric that has morally faded in this country, but that's a political issue, and I shouldn't even be going there. But this is really deteriorating. It's being dumped on the shoulders of the county, and we have to dump it on the taxpayers because they're mandates. And I think our social services does a fantastic job, but they are really struggling. I know Rhonda and I spent about an hour the other day she's saying, what can I do? These needs need to be met. And I said, well, you don't have a lot of choice except to continue to give these services. And, you know, you talk about the meth issue and things, but there's so many of these things. I mean, I was just thinking about it the other day, the billions and billions and billions of dollars that this country spends on drug prevention and crimes and lockups. And, you know, what is the answer? I guess I don't know, but you guys do a heck of a job, and you sit in a tough position and have to try to raise the taxes to pay for all of these symptoms that we're dealing with. So that's enough. Thank you.
Thanks, Brian. Thank you.
Thank you.
Thanks.
Anything else to come forward the board? Steve, anything for us today? Nothing? Anything else? We're adjourned.